Good morning. My name is Alan Ayers, and I am Senior Editor of the Journal of Urgent Care Medicine. I'm also President of Experity Consulting. It's an exciting time in urgent care. Over the last couple years, urgent care centers in the United States have performed over 30% of the nation's COVID-19 testing, putting us right on the front line of the nation's pandemic response. But although many patients recently may have been to urgent care only for a COVID test, fact of the matter is, for the past 25 to 30 years, urgent care is so much more. We have really positioned ourselves as an intermediary between primary care and the emergency room, meaning symptomatically the types of patients we treat are those with episodic conditions that need to be seen today, but are not experiencing a medical emergency. So these are things like upper respiratory conditions, sprains, strains, cuts, abrasions, rashes, offering same-day access to consumers and thus preserving the nation's emergency resources and saving costs for the overall health system. Consumers really love the convenience of urgent care, the ability to get in nights, weekends, the neighborhood locations. So urgent care really has been a consumer-driven phenomenon. And with that, though, in today's competitive landscape, it's really important that urgent care differentiate itself because there are competing consumer-driven phenomenon, whether it's telemedicine, direct primary care, retail clinics, all sorts of options, different apps available to the consumer. So urgent care really needs to be true to what differentiates urgent care. And first of all, that's the brick and mortar location and the things that take place within the brick and mortar location. So there are a few factors that define urgent care that differentiate us from these other operating models. The first of which is a physician, nurse practitioner, or physician assistant in the United States on site, extended evening weekend hours, walk-in service during all hours of operation, that idea of on-demand, same-day care for an immediate need, the ability to perform procedures such as laceration repairs, incision and drainage, the ability to perform an EKG, X-ray on site, and rapid lab testing. So with these things, there are approximately 15,000 urgent care centers in the United States today, and we continue to see significant growth in the industry. Growth is driven by new patients, new services, new rooftops, new geographies, and new payers. And now, internationally, we welcome the Urgent Care Association of Egypt, the Middle East, and North Africa to our global family of urgent care.